You could trust disability can do.
It has managed to achieve so much and change the lives of so many people.
We never asked for help.
Can do won the case.
I'm amazed with what you've done for us.
This was named Can Do because that's what people with disabilities felt they wanted. My name is Margaret Vita, and I've been involved with people with disabilities and their carers for many years. I was originally the secretary of Islwyn Council for the Disabled. Whenever there are people with disabilities, there are also carers, and the government began to recognise that, and in 1995 they brought out the Carers Recognition Act, and from that in 1999 came the National Strategy for Carers. Then there were geographical reorganisations, and the councils for the disabled tried to amalgamate to form one organisation to cover the whole of the Caerphilly borough. One of the organisations was given a grant of money to set up a resource centre, a centre of excellence. This was named Can Do because that's what people with disabilities felt they wanted. They didn't feel they wanted to be labelled a can't do, so they've chosen the name Can Do.
It sometimes feels that Disability Can Do has been around forever.
With Disability Can Do, I don't know if any of you already know about us. I know some of you have had help from us.
In truth, the 4 short years that the organisation has been operating, it has managed to achieve so much and change the lives of so many people that the impact is huge. Outreach has been particularly successful. Taking services to where people live has enabled them to access a service that they might never have been able to achieve access to without us.
In 1988, when my wife first became disabled, we had to adjust our daily lives. We were shocked at the services available for the disabled and carers in this area. As Pam's health deteriorated, we needed more support, and we noticed how poor the access is in Caerphilly for wheelchair users.
This is my husband Ron, and Ron had been really ill now for the past, I'd say, over 3 years.
They put me into private care and using private carers, and that was well, it wasn't care, full stop.
Well, I got into arrears with a lot, my rent and everything. And I think I was in denial a bit.
We never asked for help, but to me there was no help anyway, you know.
Can Do won the case, and I had the social services personnel back as my wife's care.
Since I've got in touch with you, Kate, there's been a toilet seat for Ron to help him up on the toilet. There's been a lift for the bed. There's been a seat for the bath to help him up and down in the bath. And we got the alarm over there. That's all since I've been with you.
Disability have helped me no end because I didn't really know which way to turn.
I would never have moved from complaining to a desk manager within social services, and I would have been the end of an issue. It would have been, well, you can't have it, so that's it.
You've wrote letters for me. You've got in touch with the electric board, gas board. You've rang the council.
I feel more empowered to deal with my finances.
With the help of Can Do, I got back the carers that I wanted back.
I'm amazed with what you've done for us.
Disability Can Do have helped us by providing an advocacy support service. I think that Disability Can Do are valuable in that they complete what they set out to achieve and fully support people in whatever they need.
My name is Chris Hodson and I work for the neighbourhood Health Board. I'm a patient and public involvement officer covering Caerphilly Borough. I've been working with Disability Can Do for about 2 years now, and one of the main areas of my work with them has been around the borough's disability forum. This forum was started some years ago by the council and the health board, and we both tried to support it and develop it as best we could. It's fair to say that we've struggled over the years, and in some meetings we had more speakers than audience. When Disability Can Do offered to take responsibility for the forum, I was really pleased. The numbers attending increased immediately, and they have a friendly, welcoming and neutral venue. It's going from strength to strength, especially now that members of Caerphilly Carers Forum are becoming involved in the meetings. I'm also aware of Disability Can Do's work in the wider community. I was able to secure them some space in our new hospital in Ystrad, and they are now very active there, signposting patients and their families to advice and support agencies. In fact, everywhere I go in the borough, I seem to bump into someone wearing a Disability Can Do t-shirt, working directly with members of the public at street level. I think this is very impressive. I know that their advocacy services have also been successful, as I have spoken to many patients and service users who have used the service and been directly helped by Disability Can Do. As an organisation, I like them and I rate them highly. They're not showy, but they walk the walk. They've become part of the fabric of services in Caerphilly Borough, and I wish them well for the future.
Volunteers are the lifeblood of our organisation. Without their support and dedication, our work would be only a small fraction of what it is today. Over the years, I have watched the volunteer team grow, embrace new members, support those who have considerable personal difficulties to overcome, and blossom into the formidable force of strength that is the current Disability Can Do volunteer team. This organisation is unique. Its work is desperately needed, and the team of volunteers are an extremely passionate, dedicated group of people. It makes me proud to be in the midst of such a team.
My name is Jonathan Curtis. I'm a trustee at Disability Can Do, and basically I found myself volunteering for Disability Can Do because it's a charity that I wanted to help out. It's the type of work that I wanted to volunteer for because this is the sort of work I enjoy doing.
My name is Alan Smith. I do volunteering because I actually get out of the house, gives a chance to give something back to the community.
I have improved my confidence by answering the phones, doing the telephone log, and then going out the outreach session.
I'm James Hogan. I help the form filling clinic, and I just feel really nice about helping people, giving them a little bit of support, especially under the current economic crisis.
I have been volunteering with Disability Can Do for over 2 years now. I feel my communication skills and communicating with other people has improved. Before my volunteering, I would not usually talk to people that I did not know. I also enjoy the social aspects of volunteering and feel part of a team.
I retired as a social worker about 2 years ago now, and found I wanted to carry on doing some useful work, and I found it very satisfying working here with Disability Can Do.
Nobody can fully understand how good it feels when a service user telephones to tell me how wonderful my staff team are or how much of a difference we've made in their lives. But more than that, sitting around a partnership meeting or attending a forum in the voluntary sector and having other professionals from other organisations, you know, feeding back to me that we are making such a difference and they look forward to working in partnership with us. It is quite a tremendous feeling.
Members of the Caerphilly Forum some time ago lobbied for Disability Can Do to take on the facilitation of the forum. We very much felt that the forum needed to be run independently of the local authority or the health board and be all about people who had disability or a caring role. Thanks to Disabilities Can Do's help, the forum is now very open and interactive and is led by us, the members. We are all able to discuss and have our say on the things that matter to us as disabled people in the borough. If I was to sum up what we got out of the forum, I'd say we'd learn new things, find out about services we never knew existed, get a chance to meet new people and able to share our experiences and actually even enjoy ourselves. Recent months has seen the membership of the forum increase, which has been really good. I guess the most important thing about Disability Can Do now facilitating the forum is the fact they are totally independent and are therefore able to help us campaign and lobby to get our voices heard. Let people know what matters to us as disabled people and what we actually need, not what other people think we need. I would encourage everybody to come along to the forum. We all have a choice and we all have a voice. It's just that some of us feel we're able to use it more than others. However, I feel personally the most effective form of campaigning won't be achieved by one individual, but by the organised and focused efforts of the forum members as a whole to get things changed for the good.
I think if Can Do hadn't stepped in, I don't think there'd be a carers group now.
They know that we got somewhere to go, the vulnerable people of this world, for somebody to fight in their corner. And as long as that's there, it's making them do a job.
The priority for the Caerphilly Fair Share area was to provide a range of opportunities for disabled people and their carers living in the county borough. This included improving their voice, building the confidence of those looking to take up employment opportunities, and increasing the understanding and awareness amongst the wider population to the needs and aspirations of people living with a disability. Together with the support from the Community Foundation in Wales, we're proud to say that we've worked hard to achieve this. However, there's still work to be done, and we will continue our fight to ensure that people in this area can access the services they need and have a say and a voice in how these services are shaped.